right, I think we'll get started. Welcome everyone to our weekly update. Again, welcome Dr. Bill Remington from not the State Department of Health, Kosciuszko County Health Department, and Rich Haddad from K21, who will give us a perspective from the social side of the pandemic and how our community is reacting. But before I turn over to Dr. Remington, I'll go through my list. I want to announce, it was just verified about 15 minutes ago that the state testing site will be here in Warsaw at least through August 8th. So they asked permission to use the park through the 8th, so that's another roughly 2.5 weeks of testing, which has been great. That mobile testing site has become very important, very critical in our defense here. The availability and access of testing has just been dramatically increased. We've averaged about 200 tests per day. Yesterday they did 280 some tests, and he said had it not rained they probably would have hit 300. So the rough estimates are about 1,200 tests have been done in 6 days. So week 2 started yesterday, and their testing runs from Tuesday through Saturday from 9 a.m. to 6 p.m. No change from last week. And again, that will go on this week, next week, and the following week, and with the final date, August 8th, which is Saturday. So the other good news is that the test results have been coming back fairly quick. I've talked to an individual that experienced a test and said that they were told 72 hours, and I think at about the 71st hour, he got a call or a text. I believe it was a text, it's a text or email, it was not a call. So he was notified within that 72-hour window, so that's good as well. And we'll talk a little bit about the issues with labs. Dr. Remington, I believe those state mobile tests are analyzed at the state lab, is that correct?
That's correct.
Yeah. The Indiana State Department of Health employees are being assisted by National Guard members. They're working in very hot, muggy conditions, rainy conditions, and I was down there this morning. There were 15 cars lined up before 9 o'clock, and they're really, really, really working hard. Bought them lunch a couple days because I don't know that they got time to go out and get lunch. So we're most appreciative of what we're getting here, and we're very appreciative of their hard work. I certainly want to thank the State Department of Health and all those great employees, National Guard members who are down at the parks right now. They will work through rain, but if there's lightning or thunder, they will discontinue. And by the way, the city has installed a couple years ago a lightning warning system that's utilized during park events to clear if there's ever a lightning issue. And we have fortunate that will be utilized for them as well. So it makes it safe, and they can continue to, again, work through rain as long as it doesn't get dangerous. The other big issue right now is that the state testing sites are not testing children under 12 years old. That was a condition when we started. They haven't tested them and will not test them to our knowledge. And I'll let Dr. Remington address maybe the reasons for that. But I didn't want folks to get disappointed. I know that's been all along the rule. We know with school coming up that we've got to address that, and as you'll hear this morning, certainly we will address that. So kind of leading into that, our MedStat CARES Act testing that the city and county are utilizing CARE dollars have been for about 6 weeks now. They have agreed to test those under 12. So there is a free site for children under 12 right now. That testing program at MedStat continues. However, they have had an issue with their lab as well as availability of supplies, and they have somewhat limited now, at least through early to mid-August, the drive-up testing. and they are limiting that testing. And I will read verbatim from their email who they will test. Symptomatically exposed patients who have been seen by their providers. So if you go into their clinic, they will test you. Again, seen by their physicians. Symptomatic or exposed patients who have an order from their primary care physician. So if you go to your doctor's office and get a note or a referral, they will test. Nursing home patients, and again, that's a different issue. But children 12 and under who can't be tested at the state testing site, but they must be symptomatic or with a known exposure. So those are the limitations that are currently being placed on that MedStat testing. So the MedStat drive-up testing has been limited by their lab concerns. Their labs are being overrun, and there's also some difficulties with some supplies. So to kind of summarize, fortunately, the state mobile site has really come at a perfect time when our local CARES sites have experienced some of the nationwide concerns of shortage of supplies and backup with labs. So again, big kudos to the Department of Health for getting that site here, and they're going to work out, and we've got them at least through August 8th, and we're very hopeful that MedStat will have their supply and lab issues taken care of by then. I would also announce probably later this week further expansion of the CARES Act supported testing in our community. We've talked with Parkview, and we're working out the final details there for drive-up testing, and that will be announced probably maybe even later today. I just want you to understand that that's not available through Parkview yet, but we have talked to them, and we just have to finalize some details. So that expansion will be helpful, and we'll see how we go. But at least through August 8th, our testing is set up well, and for the most part free. Through July 14th, we've done 318 CARES Act tests at the MedStat locations in the county. But again, as mentioned, that's obviously been grinding to a halt for temporarily. And again, about 1,200 tests through our state testing site. Also yesterday, we received guidance from the health department, and I'm sure Dr. Remington will discuss this, about those folks that have tested positive and what their self-isolation protocol is. The CDC has updated that, and I think the most important thing is that testing is not recommended strategy for returning to work anymore. It's essentially their guidelines, typically 10 days, if it's a mild or asymptomatic case, 10 days from when you test positive, or 10 days from when your symptoms start if it's a mild case. If it's a moderate or severe case, it's 20 days from when symptoms start. So, and there's more to it than that, but the big thing is that the CDC now does not recommend a testing strategy for returning to work. So, and Dr. Remington, I think that's probably important for you to address that. Also, I will have Dr. Remington talk about, Teresa Reed sent over some new guidelines from the State Department of Health about information for parents and kids getting back to school, so how parents can screen their children, and then if a child is exposed or has symptoms, again, a lot of what we just talked about, but what are the guidelines for parents with school kids when these things occur. We will be putting this information out on our city website, these graphics, and I know Dr. Remington has a means to do that, the Department of Health as well. I assume the State Department of Health, this information will also be on there, but I think that's critical information at this point in time. So, Dr. Remington, I've talked enough. Oh, wait a minute. One more thing. Ann Sweet wanted me to talk about masks and what her group is doing. There are still masks at the fire department. They are making large masks, regular-sized masks and child-sized masks that are available on request at the fire station. And they are also going to be providing, her group is going to be providing masks for Warsaw Community Schools. There's 12 to 1,300 they want to have done by the end of the month, plus Sacred Heart, Lakeland, and Warsaw Christian. Bus drivers will have a Ziploc bag of masks to hand out to kids who do not have them. There'll be several sizes being to kids as well. They've had a couple good-sized donations from community members. I know the Optimist Club has pitched in, and I don't know who the others are, but kudos to them for helping Ann and her group. They've done a great job through all this, and certainly the importance of masks is probably getting more so. And again, these masks still remain free to the community. So there you go. That's my last commercial, but that was a good one. So Dr. Remington, the new guidelines, the local updates, and the mic is yours.
Well, thank you, Mayor. I continue to hear great community interfacing across many jurisdictions as we move through this pandemic. Our case count continues to grow at a steady beat, not explosive, about 70 to 90 new cases a week. We expect the number to really jump up as we start collating the results from all the testing being done at Center Lake, as the mayor has just mentioned. So our numbers will go up. We're holding our own at the front lines. There's no overwhelming surging of cases at our local hospitals. Clinical settings have plenty of accommodation for patient care. Our ICU has plenty of accommodation, so we're very thankful for that. Those metrics will be increasingly important as we see, again, absolute numbers of cases really jump up, which might look frightening here a week or 2 weeks from now. All of this demonstrating that clearly we have ongoing community transmission of COVID, and it's not going away anytime soon. The prevailing themes of social distancing, frequent hand washing, masking when social distancing cannot be achieved are important. We want people to buy in with that. We're thankful that increasingly there are commercial settings where masks are expected as you enter the store. Our governor has been carefully entertaining, I think, all options as we are. We are not there at this point with a mask mandate. The temperament of that discussion seems to be growing, though, so we'll see. If our hospitalizations really surge, we will take that step here. Deaths are something to watch. Unfortunately, we've had an increase of deaths since we last spoke, and condolences to those families who have experienced that. It's a lagging indicator, as they say, so deaths today reflect an infection that probably started 4, maybe 6 weeks ago. But it's a solid indicator, if you will, from a public health perspective. It helps you gauge the severity of the virus. There had been some decrease in mortality rates across the country. For a season, those are expected to probably go up, again, because of that lagging indicator scenario that I just discussed. So don't take our foot off the gas with our social interventions that we're trying to achieve for this virus that has no specific treatment, at least in the outpatient setting. Testing is certainly on our mind with schools starting soon, and we greatly appreciate the State Department of Health's pop-up testing site that will linger longer than their initial plan. So thank you, Mayor, for accommodating that with city property and being gracious with them. The little glitch with them is that young children are not tested. I have heard it's because of a swab issue. I'm not sure of all the details as to why the state takes that approach, but MedStat, and hopefully if Parkview comes online, they'll be there to help provide more serving lines, if you will, for children with COVID concerns. The testing paradigm in general from the CDC has shifted a bit, as the mayor alluded. Using a test as a way to get back to work is increasingly discouraged. You just usually don't need to do that, and sometimes you trip into these people that have these persistent positive nasal tests for weeks, and it doesn't mean anything clinically, probably. So don't do that. And it's just choking up the queues for tests, which is a big issue. We need to have freed up testing capacity for the ill student that shows up at the student health nurse clinic here in schools in just a couple weeks. I am trying to champion the State Board of Health warming up to antigen-based POC, point of care testing. They're not there at this point.
Dr. Remington, explain what point of care means.
So it means when you show up at a clinic or a testing site that you have test results before you leave, or at least soon after, like maybe 15 minutes, maybe an hour if they're running behind. I think conceptually we could all see how that would benefit us as we make decisions real time with sick Johnny or Susie at school and what their families need to do. And we hope to build that. Right now, the state's greatest warmth is to use the traditional polymerase chain reaction, the molecular tests. MedStat and the State Board of Health's testing site uses that capacity from a nasopharyngeal specimen. At the state site, those specimens go to the state lab. The turnaround's 2 to 3 days. At MedStat, they use a commercial carrier that is seeing a backlog. It's no fault of MedStat or a local hospital. It's a commercial lab being swamped regionally and across the country. And this is a bit problematic right now. So turnaround for those might be 7 to 10 days, which, as you could understand, is not helpful from case investigation contact tracing. But this thought has been prominent in my mind the last couple days. When have we ever had adequate testing with this pandemic? We never really have. People can get to a test. They may have to wait a while. The test results may come after a while. But still you're left with lots of clinical decision making independent of an availability of a test. And let me just say, that's okay. It's not okay, but yet it is okay. Remember, this pathogen has no specific treatment, at least in the outpatient setting, that's been well vetted. There are some things increasingly do with very sick inpatients that are very helpful. So it's not like we need a test to drive a drug therapy for all these outpatients. The big thing a test helps with, of course, is some certainty around these painful discussions regarding isolation of those ill and quarantining of those who are close contacts. Those are tough to do without a confident diagnosis. And as you know, the COVID array of symptoms is nonspecific. So testing has its place, but we've never had 100% available tests, and we still have to behave clinically with this. So I think the playbook increasingly, in the absence of a test, should we not have a test available, will be these quarantine and these isolation and quarantine playbooks that we see come to us, just like the State Department of Health updated this last week after the CDC changed their guidance as to what frees you up from isolation anyway. If you're an ill case or a positive test, when can you go back into circulation? That's been downsized a little bit. That's good. And that's based on science and the evolving science, I would say, on contagibility of this novel pathogen. And there'll be more of that. There are some countries that are using, from what I understand, like a 7-day window in certain reassuring clinical settings with not severely ill people. We're not there yet in this country. So I think we'll see this playbook continue to change. It will, and I think it will really have some pressure on it once we nationally see kids get back to school in the next few weeks. There will be some pragmatics that push the things that we are saying in the playbook. It will take a village. I hear that a lot. That's not just from a couple presidential administrations ago. That's a lot in the discussion I hear at the State Department of Health and CDC, particularly the State Department of Health. It's going to take a village as we get these kids back to school. It's going to take some give and take for everybody. It will not be a perfect world, but it's okay. I still feel personally that it's the right decision to get kids back to school. It's a weighted risk calculus, if you will. There's risk with kids not going back to school, substantial risk. There are risks with kids going back to school. Children don't seem to be the super spreaders, if we believe the science now, and I think we can. Children are not historically the worst cases. That's pretty confident. There are exceptions, unfortunately. I think the State Department of Health and Indiana Department of Education, with their in-class crafted guidance, is a great framework to spring from. Will it be proven to be perfect? Of course not. But I think it's a solid framework. And I have full confidence that each of the school administrations in our jurisdiction have looked at that carefully and have applied it personally to their jurisdiction that they know the best. It will change for each of them. It will change for each of them as they hear from their constituency, their concerned parents or students, teachers. It will take a village here. We can do this. We have a land of options, of course, so if families are just not there with comfort in returning their children to school, then don't. You have other things you can do, and that's okay. I think in-class instruction is very good. Figuring out even how to do band and choir and sports, we will try to do this. It will not be perfect. There will be lessons learned as we move forward. I have full confidence with each of the school corporations in this county. Each are taking a little different look at it. That's okay. Our neighboring counties and their school corporations each have a little different take. That's the Indiana style. I'm okay with that. We need to give it a shot. Thanks.
All right. Thank you very much. So I'll turn the microphone over to Rich Haddad, the director at K21 Foundation. Rich has been always been a great community asset, as is K21, their support of recreation and the health and wellness of our community. And as the pandemic has impacted everyone, I know they've had to shift gears like everyone else. And I think I'll let Rich talk a bit about how K21 has reacted and things, observation that he's seeing in the community and ways we're all in this community coming together to get through it. Rich?
Thank you, Mayor Tallmer. I appreciate the invitation this morning. Dr. Remington, very much appreciate you and the entire health department and what they're doing for our county. I know it's been a long, difficult process, but your levity and your science based, I think, observation and counsel has been very much appreciated. So thank you.
Well, thank you for saying that. I appreciate it.
Yeah, and just as opening remarks for those that aren't as familiar with the K21 Health Foundation, we've been around for 20 years in Kosciuszko County, and our mission is to really be for the benefit of Kosciuszko County residents, to ensure healthcare services are provided, and to advance prevention and healthy living. So obviously this crisis that we're all working through, living through, and challenged through is certainly in our mission. in practical terms, we are here to provide funding for health and wellness needs and opportunities that impact our county residents. I just want to start off by really giving a kudos to Mayor Tallmer's leadership and actually gathering a lot of community leaders and others involved in trying to work on the right solutions, the right programs, the right services offered. Specifically, most recently, the state testing coming to our county. I know Dr. Remington mentioned that that was possible quite a while ago, and then it never transpired. And so, to have a team to really work on that, I know specifically Northern Indiana Hispanic Health Coalition that is based in Elkhart but serves our county as well, has a presence here, was instrumental and really ahead of the game because of Elkhart's kind of problems being ahead of ours, being able to bring that experience down and helping us with the testing coming here and other things. So it's a good example of just our county working together to do what's best. So thank you for that kind of collaborative leadership. Just a little bit of what K-21 has been doing and involved with, and then I'll just make some kind of community comments and observations. Our board in mid-March, as this thing was starting to become known and realized it was going to be a significant issue for our community, immediately approved $100,000 to really look for ways that we can help. And so it was an open-ended $100,000 commitment we made on the front end. And those funds have essentially played out in about 5 different ways. First, we partnered with 3 other funders, the Kosciuszko County Community Foundation, United Way, and the Zimmer Biomet Foundation, to pool our money to immediately respond to basic needs in our county. That was mostly in food access and food availability to those that would have been immediately hit by a loss of income and other effects of the crisis as it grew. And then the second wave of that partnership really focused on residential services in our county. Again, I think we realized that those that were responsible to house others were really going to face a difficult time and needed additional support. And so the various residential services like group homes, addiction recovery homes, homeless shelters, those sort of places, we knew were going to face additional pressures to try to manage the residential services. And so that was the second wave that we partnered with those organizations. Additionally, we provided support for childcare for healthcare and frontline workers. We had a pop-up childcare center that was specific for those families and employees that needed to work and needed some support in childcare. We also helped with relocating our homeless shelter fellowship missions to a camp environment so that they could spread out, could also isolate those either being tested and waiting on the results or quarantined because they'd been exposed. And so that camp environment really helped fellowship missions continue to provide and actually welcome new clients that needed shelter in a way that was much safer than their in-town location. And then we were able to provide some PPE equipment for a lot of the smaller community police departments that needed, again, frontline needed to serve our community, and they needed some additional equipment. And then finally, we've responded to several nonprofits that came to us for COVID-related impact on their finances, whether it was a loss of the ability to have fundraisers or their programs were suspended for an indefinite amount of time and really lost program income and those sort of things. So we've had some quick grants to some of those nonprofits. The other thing we did, or I reached out to really all the nonprofit relationships we had in the community early on and just wanted to let them know that we were here for them, that we were supporting them, and that we were open to the needs as they started to form. I think early on, a lot of the organizations didn't know exactly how it was going to affect them. They didn't know that the PPP employee support program was coming and those sort of things. So there was a lot of angst and concern, and really just wanted to let them know that we were here to help them through this. And so one of the observations I guess I've made over the last couple of months is that most of our social services and nonprofits in our county have been incredibly supported by our community. Just amazing to to watch our community step up and respond to those important social services that were needed. Individuals, churches, businesses, so many have said, how can we help through volunteerism, through funding, through supplies. It's really been incredible to see our community step up in the crisis to help our nonprofits and social services. So just a huge applause, quite frankly, to our community, just showing how caring and how supportive our community is when they see needs. It's been incredible to watch and to really support and cheerlead that. I guess in the process of that, obviously there's funding that's needed in so many different ways, and I just want to remind the audience that there have been so many different funding sources that I think we've tapped into and need to continue to tap into. Again, as a foundation, we're here and we're looking for those gaps or the lack of funding places that we can maybe step in and help. But as a reminder, the PPP Forgivable Loan Program for organizations for small businesses has been a massive help to nonprofits, churches, and small businesses to help sustain their staffing through this crisis. So over 2 months of support, really, and you think about how people can retain their lifestyle, their living expenses being supported, and to have that program was hugely beneficial to the small businesses and other organizations in our community. Also, for those that weren't aware, or maybe not to the extent, the state has made available $3.5 million into our county as part of the CARES Act. Now that's money that the county, the city, the towns have all have to have I guess, approvable projects to help with COVID, but those funds have basically been made available so that our communities can look for those needs, look for qualified opportunities to utilize that money and be able to support through the crisis. And so I think that's a huge resource. The challenge is, how do we find the right projects and the right needs that match up with the state's available funds and use those? They're meant to be used. How do we figure that out and use those? Schools also have CARES Act money to meet a lot of the needs that they're identifying through their planning, and how do they tap into that? And also, just as again a reminder, both Kosciuszko Economic Development Corporation and the Chamber offer very favorable loans to small businesses to help them through the crisis. 0% interest, no payment for 6 months, those sort of favorable opportunities to help businesses get through this and get to the other side and kind of get back on their feet, which we'd all love to see happen sooner rather than later. So there's a lot of different sources. Again, K21 is really here to just be one of those other opportunities or options to help funding when it's needed. But I think it's important that as a community, as municipalities, as small businesses, as nonprofits, we all look for every resource we can, because we need all of those options in order to try to get through this and be healthy on the other side. Our focus now has been to try to review and see if there's a role that K21 can play as the schools plan their reopening. I think Dr. Hoffer was here maybe 2 weeks ago, kind of laying out the plan for Warsaw schools, and I've read in the news how several of the county schools are starting to then release their plans. So as a reminder, we have 5 schools that actually serve the kids of Kosciuszko County. They're not all sitting in our county, but you think about all the schools that serve Kosciuszko kids, there's actually 5 school systems that do that. And so again, as they look at the various sources of funding that can help meet the needs they've identified, similar to the nonprofits, I reached out to each of the superintendents and said, we're here for you. We want to be available and open to needs that you can't meet any other way. Again, tap into all those resources if you can, obviously, but just know we're here for you if some of those needs can't be met, and we can be of help. And already had some communication on some ideas related to that. So, and I know that United Way is very involved. They're looking at care packets for kids that have the basic needs, those sort of things that as they again, the school systems say each kid needs this or that. We know that there's families that may not be able to provide that supply to the kids, and I think the social services and the churches and others, like Warsaw Community Church, they're kind of rallying around United Way to try to help provide some of that material for the kids, and which is, again, great to see. Just want to finish with a couple forward thoughts. I think as it relates to the nonprofits and social services of our community, I think, again, I look at the amazing community support in the crisis. Our concern, as we just talk about it, is as this crisis lingers and as we move out of the crisis, the issue of resilience, nonprofits being able to survive this, given a lot of their either suspended or loss of income, to help support their mission. And so it's important that the missions and purposes of these nonprofits, which are very vital to the health of our community, remain or survive in some way. So how do we deal with the resilience of these services? And then secondly is recovery. Obviously survival is one thing, but to get back to full impact and full support of those that need their services, how do we help them do that? And then lastly, for the community, I would just encourage everybody to remain generous and engaging. Again, it's been amazing to see our community in so many different ways step up, and I would just want to encourage you to keep doing that, keep responding, keep looking for ways that you can invest and support the needs around you. Secondly is to be responsible personally. It's going to take all of us doing the right things together. I don't think this is a political issue. This is an us issue. And it's important that we're all responsible and we're living our lives in a way that's responsible. And the last thing is to be respectful. We are one community. We all do care for each other. Obviously, through these actions, we see that. And it's important that we remain respectful of each other in a way that is supportive, and that our county, our community continues to just rally around the difficulty we're in and be able to, again, be healthy coming out the other side of all of this. So with that, I'll turn it back over to you guys.
Thanks, Rich. Quite exhaustive and extensive discussion that, again, is the bigger concern I see is we don't know where we're heading. You know, there's still some uncertainty ahead, so I think the tenets you've laid out are going to be applicable for some time, and I certainly appreciate all that you're doing and all the social service groups and foundations, and you guys were there right out of the chute, and it's obviously shown in our community, so thank you very much. Just a quick comment, the PPP remains effective program, so those that have not applied still have the opportunity to do that.
Yeah, I think the perception is that it was a program that's come and gone, and it actually, the last I knew, it was still open and available to those that had not applied yet, yes.
Many people have taken advantage of it, and I think there are businesses that may have hesitated at first, but as you suggest, it's critical, again, for that sustainability and hopefully the recovery effort. So thank you for reminding us of that as well. CARES Act money, the state, our local units of government, our AIM organization. I've spent some time in Indianapolis working with the governor's office just this week, talking about how we can take that CARES Act money and be maybe a little bit more specific on how we can use it. I know, fortunately, with our testing, that's a pretty obvious approval to do that. So that's been well utilized from that fund, but there are certainly other uses of that money that we're just trying to gain more clarity, and I know the state is working to work with the Department of Treasury to help us all understand how we can use that money. So that does remain a bit of a challenge now.
Yeah, and I think the reminder too is that each incorporated town in our county had an allocation available to them. So it's not just the county and the city of Warsaw. Every community has something
given a little bucket
to be able to try to tap into and help with their own community.
The money is supposed to be, there's a window on the utilization of that money, and it'd be the end of the year, but there's actually another version of CARES Act coming out probably this week or next that might address extending the deadlines for this group, this tranche of money, and then the new CARES Act could discuss money for revenue replacement for cities and towns, small businesses. So just kind of everybody's waiting to see what's going to happen with that as well. So, all right, I think we're to the portion of our press conference where we'll take questions. Yes, Mr. Spalding from Ink Free News.
Dr. Remington, I was hoping you could address this issue. A lot of people are claiming that anyone, if somebody has multiple health problems like diabetes, respiratory, and they test positive for COVID and they die, it's marked as a COVID death. Could you clarify or explain how they arrive at a COVID death when there's multiple health issues?
It's a great question, and one of substantial discussion with the CDC and the state as they try to get to the right data on this whole thing. It comes down to clinical judgment when filling out the death certificate. So that's in the eyes of the beholder of the particular clinician, the physician, filling that out. And there's growing guidance from the CDC and state as to how you look at a COVID death. If you feel that COVID was the primary event, that would be your lead diagnosis on the death certificate. If you feel that the death was primarily because of the COPD or their diabetes or the congestive heart failure and COVID was a minor issue, then if that was the honest discretion of the clinician filling out the death certificate, they would complete the death certificate in a different way. Very loaded discussion. It really does come down to clinical judgment and some semantics, if you will, as to how you use wording. And the tough thing is to get the right data regarding the most unfortunate side of the pandemic, and that's the mortality rate. So death certificates, they teach you when you're a pup in med school, are notoriously unreliable. You think it's this rocket science and solid thing, but it's full of clinical judgment and the individual clinician's view of what the final pathway was for that given patient. So it applies itself in some ways to completing a death certificate, even when a complex patient also has a positive COVID test. Or maybe they didn't have a positive test, but you highly suspect it. So there are some nuances and some guidance specific to that regarding those clinicians filling out a death certificate. So, yeah, it's a good question.
So just to be clear, if somebody has been tested for COVID and they die, it's just not blatantly marked off as a COVID death?
So you're speaking to a physician who's not in the trenches in these clinical settings, but as I understand it, if it was your honest judgment that it was a side issue, that's not your lead diagnosis when you complete the death certificate. Right. Mm-hmm.
All right. Yes, Nick Dranick.
Dr. Remington, I'm wondering if you could kind of clear up the executive order that the governor put out earlier this week regarding the approval through the health department on certain events or special events. And I talked with Nicole a little bit about this, and she was going to try to get some clarification, but it seems like there's a lot of confusion on whether or not the approval needs to come if a event is supposed to exceed 250 people, or if that's any group that needs to hold their event in like a public place. Can you clarify on that a little bit?
It does need clarification. You're right. It does. That was yesterday's topic. I don't have an answer today. But we're starting to engage with organizations, communities who have an event planned and needing to vet it with us. So we're figuring it out. It's good to vet these things. The what we're looking for basically is the plan has to address capacity limits, some guest information, staff and volunteer screening, social distancing measures, increased sanitation, face coverings compliance. Some of the specifics, particularly when it comes to capacity limits, I think is probably one of the biggest things. What groups does this really apply to? So we're trying to get clarity on that. But we're poised to interface with these communities and event organizers to look at their plans.
Yes, Dan.
This is for all three of you, if you don't mind. It appears as if, as Congress looks at another major funding proposal for the pandemic, that they don't have much interest in keeping that unemployment level, that bonus level of unemployment support going. And I'm wondering how severe that might be if they don't provide that extra cushion. Lots of worries about rental evictions and people not being able to afford housing and probably food. If that does get passed without the cushion, how big of an impact do you expect that?
Well, I would start by saying that I know the state is involved in programs that might address some of the issues that you've brought up, whether they would supplement the unemployment fund with some CARES Act dollars. Again, these are all great questions that I can't answer, but I know there's discussion about. We asked the governor's office Monday to consider utility supplements because a lot of small communities that have municipally owned utilities are seeing a lot of concerns with late payments and non-payments and the potential for shutoffs, and that is obviously as big a concern as rental assistance and everything else. And I know Rich sees from the social side, that we've got organizations locally that are helping with rental assistance and utility assistance. But I think you asked the $64,000 question that we're trying to position ourselves with those dollars. Would they be utilized at the federal level to address those concerns, or would they be passed down to the state for the state and locals to address those issues? And that seems to be the way the CARES Act money has been distributed through the states. Of course, the federal side has been looking at the preservation of business, through the PPP and the other programs. But the program we've seen and how our money has been distributed, it looks like the state has, they're giving the states the authority to utilize that money with federal guidelines, of course, but to siphon or funnel that money towards those concerns that are most problematic in their community. And as an example of that, our state we rely locally on property taxes for, I think it's around 58% of our revenue. Some states rely on sales tax, some states rely on income tax, don't rely on property tax. Some communities, there's crazy sources of income like mineral rights and gambling revenues. There's a huge mixture of how local governments are funded. And in our state, being based on property tax revenue being the significant portion, we're going to see our revenues drop for our income tax and some of the others in a more delayed sense. So our funding formulas for local option income tax are 2 years ahead or 2 years behind, however you want to look at it. So we're collecting money that was, we're receiving money that was collected in 2018. So the point is that all states don't operate like that. Tennessee was an example given. We were on with Senator Young last week talking about this issue. Tennessee has no state income tax, but they got like a 12% sales tax. So if sales with no income tax and sales start dropping, these communities are impacted immediately. So each state has a unique set of circumstances that I believe the federal government is providing the state with those funds to be funneled towards what they feel is most important. And we're in the process of that even with the current CARES money right now. So, Rich, anything to add as far as the impact on our community as this thing potentially drags on?
Yeah, I think the social service and basic needs network of our community was here before the COVID crisis and will be here after it. And so I think there's going to be, as the mayor referred to, there's going to be a safety net or a service or an assistance there for those that need it and step forward to ask for that help. I'm not a politician, but my observation personally is that whenever you try to create programs that blanket everybody, there's always tends to be some unintended consequences that you realize later. And so you mentioned the $600 a week bonus unemployment. Are they going to look at that in a way that has some caps to say, we want to make sure you're as whole as we can make you, but it shouldn't really be a raise to where it disincentivizes you to get back to work when the opportunity presents itself. So that, I don't know what the next round will be, but I know that really wasn't the intent. It was to help through a crisis that required more. And so whether that's a state or federal level to consider, I'd like to see assistance programs that help keep people as whole as they can be through this. So we'll see.
Okay. Dave?
Dr. Remington, now that all the schools have generally released their plans, kind of a two-part question. First of all, have you seen them and what do you think of them overall? And second of all, one concern that I've seen out there is if a parent has their student participate on classes only online, they're not allowed to participate in extracurricular activities. Can you explain why that might be a good thing health-wise? I mean, they're interacting with other students less since they're only doing extracurricular, if that makes sense.
We have seen the outlines of the plans. I am not the one to quote you chapter and verse with each of them, but they fit within the framework that I personally have seen come out of the Indiana Department of Education and their in-class guidance, which was in conjunction with the State Department of Health. Each school corporation will make decisions how they operate in that framework, and this issue of sports participation with those not in class participating as a student, I've heard in the last few days is a very contentious issue. I don't know that I can solve that for each school corporation. It's really not my place to do that. But let me just say from the medical side, if you are a parent or a student who feels that the classroom isn't for you because of your risk of acquiring this infectious pathogen that's respiratory and droplet spread, then why would you submit yourself to a extracurricular activity that poses maybe in some novel ways the same risk? And as I have heard the school administrators talk about this, that's kind of the framework. It's in their minds as they make these decisions. Can I say football practice is more at risk than a school setting? I don't know that I can weigh that really, but both are at risk. So if you are a family unit that says that risk isn't for me, then I don't think you should be playing football as well if you're going to be consistent with that thinking as a family unit. And I don't take fault at that. That's one of your options, is to think like that, and that's okay.
All right. Anybody else?
I have a question, but it's not quite COVID, sort of. Rich, where are we on the ice skating rink Do you know, can you give us any updates?
You're right, that's not COVID related.
Do you want me to respond to that?
Sure.
Mayor? Yeah. Yeah, as a reminder, our foundation made a pledge to help bring an ice rink pavilion to the community. Last year, that was the pledge, and I know Warsaw and Winona Lake, trying to centralize that solution, wherever that would land, have both been working on plans. I know Warsaw is still working on plans. We have just recently received plans from Winona Lake. So again, both communities have an interest in that. We'd love to see that come to fruition, obviously, for the benefit of our county. And so there's progress there, but really in kind of the clarification planning phase. And then again, most recently, Winona Lake has put together kind of a plan for our board to take a look at.
Before we finish, I did want to mention, right now, we're planning on going through August 5th on a weekly basis. So we'll meet next week, and then the 5th, and then we'll go every other week in August. So August 19th, we'll meet the 5th, and then we'll meet on the 19th. If circumstances dictate, we can obviously change that. But we'll go, starting August 5th, we'll be going every other week. So the 19th will follow, and then I'm not sure when the next one is after that, but that's our tentative plan right now. We seem to have a lot to talk about when we have these, but I don't want them to get stale, and we'll try every other week. But if issues come up, especially with school starting, if we need to have more frequently, we'll go back to weekly. So, all right. Anyone else? Again, just a reminder with masks, as Dr. Remington alluded to, the absolute majority of national chains and large retail in our community are now requiring masks, and we're asking that carry over to anytime you're in a public space where you can't socially distance. Maybe smaller retails that don't require. I think it just makes good sense. It's good practice as we move ahead. Hopefully we will not need to worry about issuing a mask mandate. Let's just talk about trying to, as Rich said, maybe be respectful for not only your health, but the health of others in those situations. This thing does seem to can spread quickly in different ways. So not knowing where it's at, I think it's best to assume it's around all the time. And again, with our local organizations helping us with masks, making masks and distributing them, hopefully everyone will have that available to them, and will, more importantly, take advantage of it and wear it. So, all right, with that, I think we'll sign off for today. Again, thank you all for coming, and we'll see you next Wednesday.
Thank you.
Well, thank you, Rich. Appreciate
That was
it.
great, yeah.